This morning in Health Watch, C-sections in this country are at an all-time high. About 31% of all deliveries. But a new study says too many planned C-sections are performed too early, which could not be great for your baby. Dr. Rebecca Brightman is an OBGYN at Mount Sinai Medical Center here in New York. Good morning.
Good morning.
We've reported for some time here about this increasing number of C-sections. How do you account for it? What is that all about?
Well, first of all, about 30% of all women who are delivering will end up having a C-section. Of these 30%, about 40% of these women are having repeat cesarean sections.
Okay.
So as the section rate increases, so too does the risk of an increase.
But why are they happening so early? I mean, isn't the sort of the gold standard 39 weeks?
Well, the full term and due date is actually 40 weeks.
Okay.
And ideally, and in the past, one was considered to be term after 37 weeks. We now know that there are some risks of planning and doing a delivery electively prior to 39 weeks.
Right. So this should be a real big, serious warning sign to people who are out there saying, I want to cut it short, I want to do it this, I want to be able to, get to, so-and-so's, my brother-in-law's birthday party.
Right.
Exactly wrong. What are the downsides, especially of these earlier C-sections?
There are downsides, and even delivering a baby as early as 38, 37 weeks, there are increased risks of babies having issues with respiratory problems, infection, increased risk of admission to neonatal ICUs, issues with babies controlling their blood sugars, hypoglycemia, things like that.
Right. This is not insignificant stuff. I mean, this really should be big warning lights going off for people that doctors should be encouraged. And I guess that's the thing that's a little surprising to me. Why would doctors go ahead and allow their patients to go early?
Well, patients get so tired of getting pregnant, and they really, they're begging their doctor. They want to plan things. Right. Doctors want to plan things. Sometimes it's hard to actually get things on the schedule.
Right.
But the truth be told, if you end up with a baby with a problem, and that baby ends up in the ICU, and you can't leave the hospital with that baby, who cares about the convenience? I think when people realize that there are some risks, then they're willing to say, you know what, I'll wait till 39 weeks.
Let nature do its job.
Absolutely.
All right, Dr. Brightman, thanks so much.
Thank you.
Do appreciate it.